Acupuncture. What is it? Who can it work for? Can it work for you? Can it work for me? Today we'll be talking to Dr. Stephen D'Antonio at the Whole Family Healthcare.
When I wake up, well, I know I'm gonna be the man who wakes up next to you. When I go out, yeah, I know I'm gonna be the man who goes along with you. If I get drunk, well, I know I'm gonna be the man who gets drunk next to you. And if I haver, yeah, I know I'm gonna be the man who's havering to you. But I would walk 500 miles and I would walk 500 more to be the man who walked 1,000 miles to fall.
My name is Steve D'Antonio. I was trained as a naturopathic physician out in Seattle, Washington at Bastyr University. And moving home to Florida, I went back to school for acupuncture, got my master's in acupuncture and oriental medicine. And about 6 months ago, I opened up my own clinic here, Whole Family Healthcare, where we do a variety of natural health care services, including acupuncture, nutrition, detoxification, and nutritional counseling.
How does acupuncture work?
Acupuncture is a system based on 2,000 years of Chinese medicine. And basically, acupuncture, there's meridians or channels in the body, and I can show you on some pictures that would be nice for you.
Great.
And there's normal flow, just like there is normal flow on I-4 traffic. Okay, when there's a traffic jam or there's a blockage in one of the channels, people usually have pain or dysfunction in their body. And so to open it up, just like a traffic jam on I-4 where they detour the traffic, we use the needles to open up the channels or detour the negative blocked channels up so that people get a reduction in their pain or an improvement in their other symptoms.
And what conditions do you treat?
Everybody's pretty familiar that acupuncture is good for pain reduction. So a lot of the people that come in our doors have, knee pain, ankle pain, joint pain, low back pain, headaches. But it can also help a lot of digestive disorders, people with acid reflux or gas and bloating or inflammation. It can also help with some neurological diseases such as neuropathy. People that get in car accidents, a lot of times we can get them pain-free, feeling better than before they were in their accidents. In females, it can also help with hormonal imbalances, so PMS and fibrocystic breast disease and those type of things. For mood improvement, a lot of times we can use the acupuncture and herbs for treating depression and anxiety and nervousness. And so acupuncture, according to the National Institute of Health, they can treat about 300 different conditions. So I can give you a handout on that as well.
Tell me, do you have any side effects whatsoever when you do what you're doing?
So there are acupuncture, there are some potential side effects. If you do not eat or have something in your stomach before you come in, sometimes when we give you an acupuncture treatment, you can feel kind of weird. Some people get a little nauseous, and so as long as you eat something before, it's okay. Sometimes there's parts of the body, if we use strong stimulation of the needles, it can actually cause some bruising, which is temporary, a couple days. Other than that, there aren't too many negative side effects from the acupuncture.
So, what do you typically feel like afterwards?
So depending on what the patient's coming in for, if they're coming in for anxiety, then usually they have a sense of relaxation. They feel really calm when they, as a result of the treatment. When people come in and they have low energy, over time, a lot of times we'll build them up and they'll feel a lot stronger or a lot more energetic afterwards. People who have pain usually feel pain relief, sometimes for 24 hours, sometimes for 48. As the treatment progresses, sometimes up to a week or 2 weeks with each treatment.
All right, and what made you get into this type of field originally?
So back when I was an undergrad at the University of Florida, I was ready to go to regular medical school, and my grandfather got diagnosed with cancer. And he was a very good patient. Whatever his doctor told him to do, he would do. They told him to take medication, he would take the medication. And he had a lot of ailments that were largely preventable with proper diet, lifestyle, and some herbs or acupuncture. And so I knew there were plenty of good doctors out there who could diagnose when he had a disease. but I wanted to offer different treatments so that when people listen to their doctor, they would be able to prevent most of the diseases that he had. And so that's why I went into this. Acupuncture specifically, after practicing naturopathy for 6 years, there were patients who had pain that I just didn't know how to treat, and acupuncture has been a really effective treatment for those folks. So as you can see on here, these are the acupuncture channels or meridians. These are the energy pathways. So for instance, if someone has pain in their lower back, you see all the channels that run up and down in this area. Say somebody has pain in the lower back here, we'll do a couple points above it, a couple points below it. We'll reestablish flow in that channel, and the pain usually goes away. We have points in the hand here that actually communicate directly with the lungs in here. And so we can access different parts of the body with different points. Another good example is stomach 36, which is a point in your lateral side of your leg. It's used for all kinds of digestive disorders, so if you get an acute nausea or diarrhea. But what it also does is they've measured blood tests, and they've measured your white blood cell count, which is your immune system, before and after treatment, and they showed an improvement or an increase in your white blood cells, your immune system, just by sticking a needle in this part of your leg. So that's the basics of the energy channels and acupuncture. That's for him, man.
Right here, right?
That's perfect.
Right there. Okay.
This is the size of an acupuncture needle.
Easy
See
man.
how small the point is. And usually we just sit on the patient, hold them down,
Yeah.
and jab it in.
Hope not.
Actually, in this country, we use single-use only needles. We use them once, and we dispose of them in the Sharps container. They do things a little differently in China, but this is how we do it here. So most points are about the size of that diameter, and you only have to go in about that deep, 1/4 of an inch maybe. If somebody comes in with low back pain, sometimes we'll go an inch or 1.25 inches before we get the body to feel it. But when I put the point in, I'm trying to activate or turn on that point inside the body, so the body has an awareness that there's a problem, and this is how to fix it. So the first point we're going to do is in this hand here. Breathe in. And feel it?
Mm-hmm.
Strong?
A little bit.
Next point is called Yin Tong. It's located between the eyes, and this has a calming effect. And usually when someone gets needles for the first time, I usually like to put this one in. Some people say this relaxes them just like having a drink. Do you feel the pressure between your eyes?
Not really. I got nothing up there anyway. So
Have the same points on the opposite side, so large intestine 4 on the left is the same as large intestine 4 on the right.
Oh, I feel that one.
The areola is a point called stomach 17, and this is a point that we will not be needling today. It's called one of the forbidden points. So there are definitely points in the body that have no function. But say Ryan came in and he just had shoulder pain, okay? And it wasn't one of those points along that channel. We would just put the needle where the pain was, stimulate it, and this is called an Ashi point. So a lot of times those still work, even though they're not the same points identified on all the diagrams. Feel that one?
A little bit, yeah, I do.
Okay. Hello, ladies.
The strands in your eyes that color them wonderful stop me it up with the trappings of a